సత్వ నాలెడ్జ్ సిటీలో అయితే జరుగుతున్న 3 days ఈవెంట్లో అయితే సైన్స్ అండ్ ది సిటీ గురించి అయితే మనతో సోమనాథ్ గారు అయితే ఉన్నారు. వారితో మాట్లాడదాము అండ్ తన గురించి మరీ ఇన్ని విషయాలు అయితే తెలుసుకునే ప్రయత్నం అయితే చేద్దాము. మేడం చెప్పండి, అంటే అసలు మీరు వరల్డ్ హెల్త్ ఆర్గనైజేషన్లో కూడా వర్క్ చేశారు, సైంటిస్ట్గా కూడా వర్క్ చేశారు. వాట్ ఆర్ ద ఛాలెంజెస్ డిడ్ యూ ఫేస్ మ్యామ్?
As the chief scientist?
Yes, ma'am.
So the challenges were some internal and some external. Internal challenges were within WHO, it was a new division. The science division had been just set up. So we had to think of the strategy, we had to think of the human resources that we need, we had to think of how to raise funds for it. So all of that was new, and also what work we were going to do. So while we were doing all that, within the first 9 months, the pandemic came. Then, of course, the big challenge before me and with all my colleagues was how do we deal with the pandemic, how to understand the virus, to make sure that we are putting the right information to the public. So challenge during COVID was, it was rapidly moving, every day we were getting new information, new research, new data, how to extract that and convert it into something that we can then give it to the public in a way in which we are informing the public and giving them the right information, but not giving them things which may still be, we may have a doubt on. And then we also played a very big role in convening scientists from around the world. That was the best part actually of my experience, was scientists, researchers, doctors were so willing to work together to find the solution for COVID.
What is your experience here, ma'am? You are coming from 3 days, so interactions between the students and engage with them. So how do you feel about it, ma'am?
What I really like about Hyderabad Literary Festival is the ambience here is like so energetic, I got up very early in the morning and traveled today, but I've forgotten all my tiredness after coming here. Because so many young people, so many school students, so many questions, so much energy, lot of music, lot of other activities going on, art, things like that. So I think that this is a lovely way to have a literary festival.
I think advancements in science and enhancing training for healthcare professions in urban settings.
I think urban settings are going to be very important for the future because in most countries, including India, people are migrating to urban areas and the population is going to keep increasing. So if we want to have a good quality of life for people in urban areas, we have to focus firstly on good housing, good infrastructure like roads, good pedestrian facilities where we can walk in cities, green cover, blue, some water bodies to be preserved, public transport to be good, and public health and education, schools. If a government can provide these things, then I think citizens of a city can have a very good quality of life.
How can science education in school improve awareness of health issues among students?
Definitely. I think science education, health education, both are needed. Because in today's world, what happens is that we have something called an infodemic. We are living in an age which we have too much information, especially from social media. And it's very difficult to know what is correct, what is not correct. So in schools, teachers, and maybe they can invite experts from outside, need to come and teach students the basics so that they can develop a critical thinking skills, a scientific mindset, so that when they hear about something, they are able to ask the right questions and then find out the correct information for themselves. That is what we need to teach our children. They don't need to learn all the facts and figures. Nobody can learn everything in the world. But how do you search for the right information? Who do you believe? Who do you not believe? That is critical thinking.
How does WHO collaborate with city governments to implement effective health initiatives?
So there's a very big program actually called Healthy Cities program. So through that actually cities around the world, they come together, they share experience, they share best practices of how to make their cities healthy. One of the big focus areas of WHO is air pollution, how to reduce air pollution, which is very high in most of the developing world.
Can you discuss any specific health challenges faced by urban populations that science is helping to address?
Air pollution is definitely one where science can help because now we have technologies that can measure air pollution both on the ground and from satellite, and we can also find out the source of those pollutants. So using that knowledge, the policy makers can make the right policies to address air pollution in different parts of the country.
Madam, the last question. How do you see the relationship between the environmental health and public health evolving in the future?
Very important question, because to my mind, environmental health and public health are coming together. They've already come together. Most of the health risks today are coming from environment, from water, from air, from soil, from the food that we eat. And so if we do not address that, and from the chemicals that we are exposed to, pesticides, heavy metals, this is what is the main threat to health now. So I think environmental health, public health, we have to pay much more attention to that. Of course, we have infectious diseases and non-communicable, but a lot of non-communicable diseases, the risk factors are actually environmental risk factors. So I think if we address those, automatically our burden of non-communicable diseases will go down.
Thank you so much, ma'am. Had a great time with you, ma'am.
Thank you. Thank you very much.
సో చూశారు కదా మన సౌమ్య సోమనాథ్ గారి ఎక్స్ సైంటిస్ట్గా వర్క్ చేశారు, అలాగే డబ్ల్యూహెచ్ఓలో కూడా వర్క్ చేశారు. సైన్స్ మీద చాలా అవగాహన ఉండింది అండ్ పిల్లలతో కూడా ఇంటరాక్షన్స్ విధంగా సైన్స్ గురించి మరెన్నో విషయాలు అయితే తన ఇంటరాక్షన్స్లో అయితే తెలియపరిచారు.